Welcome to another episode of MedTalk. My name is Dr. Tushar Patel and I am your host. We have a distinguished physician guest, Dr. Robert G. Lahita with us today. Dr. Lahita is a director of the Institute for Autoimmune and Rheumatic Disease at St. Joseph Healthcare System. He is also a professor of medicine at New York Medical College and clinical professor at Rutgers Medical School. Dr. Lahita is our expert physician during this pandemic and provided his expertise and valuable information to our viewers on COVID-19. Welcome back, Dr. Lahita, to MedTalk on our continued discussion on current state of pandemic.
Thank you, Dr. Patel. Good to be here.
Thank you. So I'm going to start by asking you a question. We have more than 32 million cases and close to 575,000 deaths in the USA since the pandemic began last year.
Yes.
Although number of new cases, hospitalizations, and death rates are in a downward trend for the last few weeks, which is very good sign, very good news. But can you tell us where do we stand now with this pandemic and where are we heading? Are we heading in the right direction?
Yes. In the United States, the pandemic is still present. Only about 25% of the population have been vaccinated. Over 50% have gotten more than 2 shots. So the problem we have is a lot of the states are opening, but there is not going to be herd immunity until we get to 70 to 80% total either vaccination or infected. Now, herd immunity, as you heard Dr. Fauci and the people at the NIH and CDC say, that herd immunity is not realistic. It's a great, sensible goal, but it probably is not going to happen. So states are being asked to open up restaurants and ball fields, ball games, and Broadway shows and concerts and all sorts of things. And what we're going to do is track these infections locally to see if there, in fact, is an uptick in the number of people infected. And of course, we look at hospitalizations, we look at deaths, and we look at vaccination rates. And the one thing that we have that we can control, we can't control deaths or hospitalizations, but we can control vaccination rates. And we're hoping that we can track that locally and that will be successful and that it will be increased. As you know, the President of the United States, he said by July, I think he said by the end of July, he would like to have most of the country vaccinated.
Yes.
There's over 25% of people don't want to be vaccinated. And so that's our goal.
Okay.
That's our very, very big goal.
Okay. So what can you tell us about the mutations and new variants coming, especially from the UK, South Africa, Brazil, and lately from India?
Well, I can't speak to the Indian variant, but I will a little bit. We have the predominant variant that's in the US is the British variant, which is the B.1.1.7. And that is a problem because its infectivity rate is 60% higher than the virus that we saw last year. But I am assured by Pfizer, by Moderna, and by J&J that the vaccines that we have cover the variants very successfully. And that includes the South African variant, as well as variants that presumptively come from Brazil. Now, with regard to India, as you know, the country has cut off all transportation from India to and from. So we have no idea as to whether there is a variant in India other than the British and South African one that is affecting people adversely. And so I am sure whatever the variant is, if there is a specific new variant in India, we will be seeing it here in the United States shortly, even though travel has been eliminated.
And the number of cases and the death rates in India coming out 400,000 every day and 4,000 deaths every day, that is not a realistic number compared to what the population we have and the poor infrastructure and not counting all the deaths and reporting all the deaths. So it's a big concern for this country, for the US as well.
Yes.
Do you agree with that?
I certainly agree with that. And I am really devastated by the fact that, for example, oxygen is in short supply because
Yes.
one of the first treatments we use besides medications is high flow oxygen, even before you get on the ventilator. And I know that I'm told by my Indian colleagues that the ICUs are very full in both Delhi and Mumbai. and in other parts of the country. But it is a big problem for the rural areas of India, and you and I know it well, where in the rural areas, the hospitals are very small, perhaps not well equipped, and oxygen is at a premium. Even though the US, Britain, and other European countries are sending supplies of oxygen to India, it remains a big issue.
Yes. What is your biggest concern, Dr. Lahita, at this time with this pandemic across the world?
My biggest concern is that we are going not to have enough people vaccinated, and that it will be deja vu like it was last year, that there will be upticks. We're looking at that here in the United States because, again, as I said, we're opening up. I think it's the end of next week where everything will be open. So we're going to look at the hospitalization deaths, and the president is trying to get people vaccinated. In India, vaccination, even though it's a wonderful country for making vaccines, I understand that the population is like 1 or 2% vaccinated, which to me is incredible. I can't believe it. And I don't understand how that can happen. But I'm hoping that President Modi of India will take that into consideration and see to it that there'll be mass vaccinations. And I think the countries of Europe and the United States are providing vaccine where they can for the residents of India.
Yes. So let's talk about the vaccination, vaccine hesitancy, and some people bluntly say they will not take the vaccine. There is so much misinformation and rumors about the safety of the vaccine.
Yes.
There are many people, they have doubts and concern to take the vaccine. Can you please tell our viewers the vaccines available in the US, Moderna, Pfizer, and J&J? Do you see any issues with taking that vaccine?
I see no issues whatsoever. Now, let me be very clear. Everybody has different immunogenetics, and that's what I write about in my new book, which will be out in October. But everybody knows about immunogenetics, meaning that we each have a different genetic system that involves immunity. And immunity is varied from individual to individual. So one individual may get the vaccine and not have any side effects. Another individual may get a fever, weakness, joint pains, and maybe some abnormal blood tests for about 3 days. I have heard from countless people who don't want to be vaccinated saying, I've heard that so-and-so has a rash. I heard that this person became short of breath. I heard that this patient had headaches for a week. You know what? I say to them, better than dying and winding up in an ICU. If you expect the worst with regard to the vaccine, you will not have any side effects. You'll see the vast majority, the millions of people that I have seen that have been vaccinated have done exceedingly well. Most of the time, very few side effects. I myself have been vaccinated. I'm not sure you have, but when I was vaccinated, I had some weakness for a day. Maybe the second shot, I had a little bit of fever for a day, and that was it. But it is much better than I have to take you on a tour and show you the intensive care unit. And I'm sure in India, you know, it's even worse than here with people on ventilators, people who die very rapidly. And that all has to do with their immunogenetics and their comorbidities. If you have heart disease, lung disease, you must be vaccinated. People with autoimmune diseases, such as I see, get vaccinated, and maybe they have a little bit of a harder time for 2 or 3 days than the average person because their immune systems are somewhat compromised. But they get through it, they survive, and they do very well. And furthermore, they're protected. So you can go to a restaurant, or you can go to a concert, or you can go to a ball game, and you don't have to worry.
So, Dr. Lahita, what happens by July, end of July, if we don't reach that 70-80% mark of people getting their vaccine? Where do we stand with the herd immunity concept?
I think the herd immunity concept is, for all intents and purposes, unrealistic at this time. Because, you know, we have over a quarter of the country that will not, under any circumstances, be vaccinated. Even within families, I have heard where the mother and father are vaccinated, and the young 20 or 30-year-old children refuse to be vaccinated. So they've separated and say, don't come to our house until you get your vaccination. And they say, well, we're not coming at all. We'll do virtual discussions with you. So there are people who are very stubborn out there. And unfortunately, it's politicized a little bit. Yeah. And, you know, there are certain political people that say, no, I'm not going to. The same people who won't wear a mask will not be the ones that will get vaccination. and I'm apolitical. I'm both bipartisan, but I think that this is not a political issue. This is a public health issue. And if you want not to spread the virus to children or to elderly people, just have to get the vaccines. Vaccines are exceedingly safe, exceedingly safe.
So what can we do, Dr. Lahita, to have these people convinced that the vaccine is safe? They should take the vaccine. What else government can take?
Well, we've done everything from give them free donuts to free beer. To free dinners to $100 gift certificates. I mean, I don't know what else you do except to convince people that the vaccine is very safe. One of the things you can do is perhaps take them on a tour and show them, those who are very recalcitrant, show them what goes on in the intensive care unit, have them talk to people who have lost dear loved ones. And that would be kind of a draconian way to make them believe that the vaccine is safe, is to take them and show them what happens when you don't take the vaccine. People just don't know what their immunogenetics is. You know, one person could have a terrible reaction to the COVID virus, not the vaccine, the virus, and another person may have a very slight disease with almost no comorbidities and no sickness. The vaccine is guaranteed to rev your immune system up. And the good news is that if you do have side effects from the vaccine, you know that the vaccine is working because we don't expect it to go into your body and not have some reaction. The more fever, the more achy and pain and weakness you have, which means that your immune system has been turned on and it is actively working. To protect you. That's important.
So what I heard from the Biden administration that the vaccination, the mega centers, the mega sites are being closed down soon, and the vaccination will be distributed to the local pharmacy, about 40,000 pharmacies in the country, yes, as well as the primary care physician. Is that a good idea?
Yes, that's a great idea because I think everybody should be vaccinated. And this business of having certain groups and certain age groups and not having young adults vaccinated is not the way to go right now because the demand is very low, particularly in the rural areas where people are very reluctant. So nobody's out there to give them the vaccines. We don't have tents with the National Guard or nurses that we truck into these areas. So it's better if somebody like me gets the vaccine to give to my patients or some family practitioners or general internists. That would be the way to go, to have the doctor's office administer the vaccine, because we can keep track of who we give the first and second shot to and who gets the shot, who doesn't get the shot. So it's a very good way to distribute the vaccination, to make sure everyone gets it, distribute it widely.
And the patient also get more comfortable by getting the vaccine at their own pharmacy or the own primary care physician.
Right. They don't have to wait in line.
Wait in line.
They don't have to drive up and be told that, well, we're sorry, there's no more vaccine left, which is a lot of frustration for a lot of people. Plus people in poor neighborhoods, people who don't have access to Wi-Fi, don't have computers, they have a place to go where they can get the vaccine. They can't make a reservation on the computer or wait for hours on the phone to make a reservation. It's much easier. And as far as India goes, I don't know what they're doing in India to ensure that the vaccine is going to be widely distributed, but now is the time to do it. It's no longer time to wait because the death rate is just going through the roof there.
Yes, exactly. So what steps can we take to stay safe and save lives between now and end of the pandemic? And also, can you elaborate more on opening the states with all the restrictions lifting and doing mega events in this country?
Well, we're going to find out. My concern is, of course, about the variants. But now we have lowered the number of cases per day significantly, and 41 states out of the 50 states are talking about opening up. And so opening up means that you don't have to wear a mask outside if you're with other vaccinated people. You don't have to wear a mask in a closed space if you're with other vaccinated people. But when you're in a public concert or a ball game or football game, or you're in a Broadway show, or you're anywhere where there's a crowd where you don't know that there may be people who are not vaccinated, you still have to wear the mask, social distance, and make sure you wash your hands. Now, that could be in the temple, that could be in the church, that could be in the synagogue, that could be anywhere where there are people gathered together in large numbers. And I say that very, very strictly, that people have got to pay attention and have to treat this virus like it was radioactive powder. I think that's probably the best way. Or glitter. You know how glitter, you have a tile that has something with glitter on it, it gets on everything. That's the way this virus should be thought of. It can get on everything and get on you, and you can be coughed upon or breathed upon, and you can certainly get infected very easily.
So, Dr. Lahita, when do you expect changes in our routine life from the current pandemic to new normal with pre-pandemic state? As you know, I'm a very active, and so do you. We have postponed so many activities in last 12 plus months. When can we get together or have social gatherings or some kind of normalcy?
I'm hoping that by the fall, by September or October, we will have social gatherings and be able to behave somewhat more normal. But I'm hoping, and I have hoped in the past that would happen. And you know what has happened. We have seen upticks every time we lower our guard. We see certain areas where infections rise. Now, the good news is that this is probably the time when there are the lowest number of cases, 49,000 cases per day, and only 700 deaths per day. But 700 deaths is still a lot of people dying per day. But the numbers have dramatically decreased. So the governors of 41 states have decided to open up. And I think for businesses and for schools, and we should, by the way, vaccinate children, very, very important. Children from the age of 12 on up are now being talked about as being vaccinated material. We are trying to get the children vaccinated so they can all go back to school and be in the classrooms. So this is, I'm hoping that in the fall, by September, that the children will be back to school and that everything will somewhat come back to normal. Although we're such in the habit of wearing masks that I don't think it's going to be for another year or two before we drop the idea of wearing a mask in public places. But we don't have to wear a mask outside when there's lots of good ventilation, when there's exercise, and when you're with other people that are vaccinated.
Yeah. So can you tell us about your new book coming up?
Yes, the new book is called Immunity Strong, and it is all about vaccines. It's about your immune response to things. It's about genetics. It's about sex and gender in the immune system. It's about the different things that infect us, such as viruses, bacteria, and parasites. And it's very, very interesting, and I hope everyone can read it and understand and learn. It's written for the common person. It's written in language that's very clear. I have editors that have told me I don't understand this. These are not doctors, and they tell me they don't understand something. I go back and I rewrite it so that it is understandable. So Immunity Strong is the name of the book. It'll be out in October. The publisher is Humanix Publishing. So I'm hoping that everyone picks up a copy. It's on Amazon now. You can pre-order it.
Oh, wonderful, wonderful. And Dr. Lahita, what is your take-home message for our viewers? I know we have been talking it for almost a year now. Every few months you come and give your expertise. What is your take-home message this time for our viewers? We are almost at the end of this pandemic. What is your take-home message?
My take-home message now is that we're at the end, and we're seeing not only light at the end of the tunnel, we're seeing daylight at the end of the tunnel. So we are seeing an open society again. We are seeing a society which will have probably no need to mitigate as much as we are doing now. Hopefully we'll get to herd immunity by next year, by 2022. Hopefully we will go back to leading normal lives and not be so restricted. My feeling is that this virus, Dr. Patel, is going to be with us forever. It's going to be something that will continue to mutate, but the vaccines are very capable of protecting us by giving us antibody-directed immunity as well as cellular immunity, and that will protect us against the variants. But like the influenza vaccine, we may have to get a COVID shot every year or every other year to protect us from any variant or mutant that comes down the pike. There are going to be many future pandemics, hopefully not soon, But because the world is shrinking and everyone's traveling back and forth from country to country, we're liable to see this kind of infection in the future. Perhaps not as severe, but certainly we will see epidemics and certainly possibly pandemics going forward. But I think we've learned a lot through this whole process. I think we've learned a lot about the immune system. We've learned a lot about viral infections, and we've learned a lot about how to protect ourselves. So this is a good thing. So I'm very hopeful.
Do you think we will need a booster shot of either Pfizer or the Moderna vaccine this year in 2021?
They're talking about it, but I would prefer to talk about people getting their first shot rather than a booster shot. If a booster shot comes along, those who have gotten vaccinated already will easily go for the booster. But it's not the booster that I'm concerned about. It's those first-time vaccinated people that I'm concerned about. There are people out there who have not had their first injection and are at great risk of being infected, getting very sick, and dying. And I can't say that strongly enough.
And also they will affect their family, their relatives, their neighbors, and their community.
That's correct, and it's a very bad thing when that happens. It's something that people have to sit down and think about and ask themselves: do I not take the vaccine because I'm afraid of needles, or because I'm afraid of getting a rash or a fever or feeling weak for a day or two? Or do I want to run the chance of getting very sick, stop breathing, and wind up in the ICU and dying? And your family will not be happy if you die. So you have to look at that. At least the vaccine prevents you from dying for sure, and it probably prevents you from getting sick, even from the variants.
Wonderful information. Thank you, Dr. Lahita, for your time and providing your expertise to IndusTV viewers. Appreciate your dedicated service to medical communities in Tri-State and providing education via interviews and seminars during this pandemic. Stay safe, and thank you for your service, Dr. Lahita.
Thank you very much.